Among the most exciting developments recently in cardiology has been the development and availability of new antithrombotic agents, the thrombin inhibitors, dabigatran, the 10A inhibitors, rivaroxaban and apixaban. And of course, there have been no head-to-head comparison of these agents, and so most of us clinicians are wondering at the moment which of these agents is preferable. And to try to answer this question, a group of investigators from Europe undertook a comparison, an indirect comparison, using warfarin as the comparator. So they had data comparing dabigatran, rivaroxaban, and apixaban, each against warfarin, and used that to relate one to another. And this is a very, very controversial undertaking, but nevertheless of some interest for us at this early stage of availability of these agents. And they found that dabigatran had a lower stroke and systemic embolism rate than did rivaroxaban. However, of course, the patients in the rivaroxaban study, the ROCKET-AF trial, had more advanced disease. There was no difference for any of the agents for ischemic stroke. In terms of bleeding, there was less bleeding found with apixaban rather than dabigatran 150 or rivaroxaban. Now, overall, these investigators, having done this extensive analysis, felt that the most important finding is that there were no profound differences in efficacy between these agents. So given this, it seems to me that our choice of agent is likely to depend on other characteristics such as dosing or renal failure or things of that nature. Now, again, to repeat, this is an indirect comparison. The patients included in the various trials differed. The therapeutic regimens differed. This can hardly be taken to be the same as a direct head-to-head comparison, but nevertheless, I think does serve to put these various agents in perspective relative one to another. For Inside JACC, I'm Tony DeMaria.